The next parasite we will cover is Babesia microti. It is also another intraerythrocytic parasite, just like malaria is. Its vector is the tick, specifically of the genus Ixodes. And I'll mention here, this is the same vector that causes Lyme disease as well, but that's not a parasitic infection. It's transmitted by the tick's insect bite, but it can also be transmitted from mom to baby and through the blood supply. It has several similarities to malaria. Excuse me. It does have symptoms like malaria, but it's not cyclical like the malaria paroxysms are. So you do get fever and chills and sweating and such, but it's not that definitive, that identifiable cycle. You do not need to memorize the drugs, but it's treated differently than malaria is. And like malaria, it has alternating sexual and asexual stages, but we're not going to learn the life cycle in any detail like we did for malaria. To identify it, you do the same thick and thin blood smears, like we mentioned for malaria, from the capillary puncture. The thick is for screening, and the thin is to identify it. And it is especially important to be able to differentiate it from malaria because it can look very similar. It has that small, delicate ring-formed troph, but what's distinguishing is that it has a tetrad formation for the mature trophozoites. It's also called a Maltese cross formation, where four trophs come together in a cross shape. Extracellular organisms may also be seen, and this is unlike malaria. And also unlike malaria, there is no exoerythrocytic phase. There are no gametocytes seen in the RBCs, and there's no malarial pigment. So what's confusing is that sometimes the symptoms look similar and that the trophozoites can look similar, but the doctor needs to find out travel history and get enough blood smears to be able to distinguish between the two. And also, of course, it won't respond to antimalarials. This Babesia tends to really affect immunosuppressed patients. So sometimes most cases are asymptomatic, but it's the immunosuppressed people that can have organ failure or even go into DIC. And it's also worth noting that the tick needs to be attached for more than 12 hours to be infected with Babesia through the tick bite. So it's important if you're hiking, especially in areas of the northeastern United States where the tick tends to be more prevalent, that you do thorough inspection of your body when you get back and carefully remove any ticks promptly. So look at this picture. This looks very similar to falciparum. And why did I say falciparum? Because I see multiple trophs within a single RBC. So this is where it can, you might have trouble distinguishing between the two. However, this is your tetrad formation. This is what they mean by the Maltese cross. So this would definitely steer you towards Babesia. Plasmodium would not do this, would not take on this form. So I do see a single ring form troph, so that's not distinguishing for Babesia. It's this guy. So I see four trophs sort of coming together in this cross formation. Next is Toxoplasma gondii. This is found worldwide, and more than 50% of the people in the United States have antibodies to Toxoplasma, which means they've been exposed to this parasite. And this is characterized as an opportunistic infection because healthy people can get exposed to Toxoplasma and make antibodies and not be diseased by it. So most often, if you're healthy enough, you're not infected and you might just get some flu-like symptoms and while you're forming antibodies or be completely asymptomatic. The populations most affected by Toxoplasma gondii are HIV patients, transplant patients, and then developing babies. So one of the most serious complications is when mom passes it to baby in utero. We are an accidental host, an intermediate host. The definitive host is the household, our domestic cat. So to discuss the life cycle a little bit, the cat feces, an infected cat's feces contains the life cycle stage called the oocyst. So this is what the cat would pass, and this is what could be infective for us. And it matures either outside in the environment or in the litter box. It takes about 2 to 5 days to mature and become infected. So man is infected by one of three ways. We can either ingest or inhale that oocyst. We could ingest undercooked meat containing cysts that are full of bradyzoites from another animal, like pig or cow. So other animals can also ingest the oocysts from the cat feces. So especially where, you have wild cats and then other animals roaming around, it's possible for another animal to be infected. And if we ingest undercooked meat from that animal, that's another way for us to get infected. And then I mentioned the congenital passage. Tachyzoites can cross the placenta and go from mom to baby. So if we were to ingest that infected oocyst from the cat's feces, inside the oocyst are called sporozoites. So the sporozoites would be released, they would penetrate the intestinal wall, and they would transform into tachyzoites. So we have two new words here, tachyzoites and bradyzoites for Toxoplasma. The tachyzoites are very rapidly reproducing. So if you think of, you have your prefixes here, tachy and brady. And if you think of tachycardia and bradycardia, increased heart rate and decreased heart rate, that's exactly what these terms mean. So the tachyzoites are very rapidly reproducing and traveling to organs. The bradyzoites are the slow reproducing. They get trapped in the cyst. So in any case, the tachyzoites asexually reproduce. The cells rupture, the tachyzoites enter the bloodstream and penetrate other organs, and they could go to any organ they want to. The man's immune system responds and forms a cyst, so we wall off these tachyzoites, and when we form a cyst around them, the tachyzoites transform into bradyzoites. So here, the infection remains dormant unless the immune system is compromised. So you could have cysts containing bradyzoites and it not be a problem. But if the immune system were to become compromised and the bradyzoites could be released, they could come out from that cyst, go into the bloodstream, transform back into tachyzoites, and then go and infect other organs. And a tachyzoite can invade any nucleated cell. So the cycle could continue on. So let's talk through it again. So man can get infected by ingesting infective oocysts from cat feces, or we could eat undercooked meat containing the cyst with the bradyzoites. So these animals could have ingested the oocyst from cat feces, and bradyzoites could be in this animal meat. And if we were to not thoroughly cook this animal meat, we could get infected that way. So in either case, sporozoites get released, penetrate intestinal wall, tachyzoites form, they invade any nucleated cell, and asexual reproduction occurs, and the cells will rupture. Now, the tachyzoites can go and invade other cells, other organs, and the immune system can respond by forming that cyst around the tachyzoites, in which case they now become bradyzoites. Or if it's a pregnant woman that has tachyzoites, she could pass the tachyzoites across to baby, resulting in congenital toxoplasmosis. The diagnosis for this parasite is unique because it is 100% serologically diagnosed. So the way we diagnose Toxoplasma is by collecting serum and testing for antibodies, testing for a rising titer in IgM antibodies to Toxoplasma. And this is one of those prenatal tests they do on women. They will test you for IgG and IgM antibodies to Toxoplasma to see if you are at risk for contracting the tachyzoites, and in which case you could pass it on to baby, which would be very severe. So it's usually serological because the identification of tachyzoites or bradyzoites is extremely difficult. Those can be in any organ or tissue. It's not localized to one specific area. So in order to identify that, you'd have to do a biopsy of the organ, or unfortunately, especially in the immunosuppressed patients, they're often in the CNS or the brain. So that's why it's usually serologically diagnosed. Here's a picture of tachyzoites inside a tissue macrophage. Now, I show you this. You're not going to have to identify this because it'd be very rare to see that, but I want to remind you of another parasite that we could see inside of tissue macrophages. So do you remember this, another parasite that you could see inside of this macrophage? And in fact, it looks very similar to this. Remember, it's the amastigote for the Leishmania genus.